Things that will happen when we finally do get repealed, and I do believe we will because it's so bad. For example, you will then not be hit with a big fine by the government for not buying the insurance that the government orders you to buy. That's their plan. You will retain, if we don't have Obamacare, you will retain your right to buy health insurance that includes the benefits you need instead of a more costly policy mandated by the bureaucrats. That's the key element in this. If you want to have insurance, you should be able to buy one that suits your needs and not the bureaucrats. Now, if you are young, if we don't have Obamacare, you will not be forced to pay higher premiums for mandatory health insurance to subsidize people who are older and sicker. If you are a senior, you won't suffer $500 billion taken out of Medicare to pay for insurance for the illegal aliens, because that's the way it's planned to operate. If we don't have Obamacare, you will not be standing in long lines to see a doctor. You won't be put on a 2-year waiting list for surgery that you need. The Obamacare is such a vast takeover. The Center for Health Transformation put out a chart which explains, sort of, this 2,700-page bill, law now, which grants 1,968 powers to the Secretary of Health and Human Services, along with control over 18% of our entire economy. So that's 1,968 reasons to be against Obamacare. For example, the regulators will get to decide what clinical drugs seniors will be allowed to get. The regulators will instruct doctors whether or not to give a drug to patients in long-term care. The regulators will be empowered to use, and this is their new code word, comparative effectiveness research. Now that's the code word for the death panel, because that means the regulators will be able to decide whether seniors get care or not.